All right, in this recording, we are going to look at muscles of the back, so intrinsic back muscles, and we're also going to look at some muscles of the abdomen as well. So starting with our muscles of the back, these are referred to as intrinsic back muscles. So these are muscles that are specific to the back, and they help to stabilize and can also move the back in the sense that they can move the vertebral column. All right, so many of these are going to be attached to our vertebrae. They're also going to be attached to our ribs, and they may be attached down to our pelvic bones, our ilium, more inferiorly. All right, so we'll look at three here, and these three muscles are what are called erector spinae muscles, okay, or they're in the erector spinae group of muscles, okay, meaning they help keep the back straight, they keep it supported. They can also produce some extension and some flexion as well. Okay, so the first one that we'll look at is called the iliocostalis. All right, so we see this one here. This is the iliocostalis one segment. Here is another segment, and here is another segment as well. But in general, all three of these segments, so here, here, and here, are all known as the iliocostalis. If you break the term iliocostalis apart, you get ilium and costal, which costal means rib. So we attach to the rib, or the ilium inferiorly, way down here. All right, so we can see that here. And as we travel superiorly, they then attach to the ribs, or they attach to the costal part, right? The costal bone, so which are our ribs. So this is termed as the iliocostalis muscle, right? You move just medial to that, you get one called the longissimus, all right? And this is our long muscle that stretches all the way down from near the sacrum, goes up our back near our vertebrae, across our ribs, and travels all the way up, and then it actually attaches here to a different part, and then can run all the way up and attach to our mastoid process behind our ear. So if you feel that bump behind your ear, that's the mastoid process. You have your sternocleidomastoid muscle there, but you also have your longissimus muscle there. So again, we had our iliocostalis laterally, we had our longissimus here, and then we have this last one known as the spinalis, which are these small muscles that we see right here, okay? So the spinalis muscles are termed spinalis because they attach to the spine or the spinous processes of our vertebrae. So they attach from one vertebrae and then usually go down about 4 or so down to the next vertebrae. So if you look at these here, they attach. You can read some of the information here. They attach from one spinous process and continue down to another spinous process, all right? So these are our intrinsic back muscles. When these contract, they can move the spine in one direction or another, but they are also a very important stabilizer of the spine. So these are our posture muscles, right, that help keep our back erect and help keep our back straight to maintain good posture. So if we flip around now and we look at the anterior abdominal wall muscles, we'll see a couple. And one way to differentiate some of these abdominal muscles are based on the orientation of the fibers, okay? So if you notice the fibers of this muscle here, this is called our external oblique, all right? This is our external oblique muscle, all right? The fibers here are going to be running from superolaterally, all right? So superior and lateral, toward the inferomedial direction. So they're going from superior and lateral to inferior and medial. So they're running in toward the middle, the midline of the body, all right? And this is known as the external oblique, all right? If we hide the external oblique, we get something known as the internal oblique that we see right here, all right? So the internal oblique has fibers that run opposite of the external. So these run from inferior and laterally, so inferolaterally, to superomedially, all right? From the inferior and lateral aspect toward the superior and medial aspect, all right? So there's our internal oblique. We then have these two long straight muscles, and these are called the rectus abdominis muscles, okay? The term rectus meaning straight and abdominis meaning abdomen, so this is the straight muscle on the abdomen. This is what is kind of generally referred to as our abs, right? Now you can see that we have a muscle belly separated by a piece of white kind of connective tissue, and then another muscle belly, and then another white piece of connective tissue, and then muscle belly, connective tissue, muscle belly. This is what gives us our ab appearance, right? The appearance of when somebody has abs is due to this connective tissue, and these are called tendinous intersections. These are these little dividing pieces of connective tissue that separate one segment of a muscle belly of the rectus abdominis from another, okay? So this is the rectus abdominis. If we hide these, so let's hide these here, We get down to our last one, and we'll hide the internal oblique as well, known as the transversus abdominis. All right, so this is our transversus abdominis. Okay, now these have a hole in them because part of our or part of the male spermatic cord will pass through this and will not take any of the muscle tissue with it. But that's another topic for development in a different lecture. But this is the transverse abdominis. This is called transversus abdominis because the fibers of this one run transversely, right? They're running kind of transversely across the abdominal wall, okay? So as a recap, we had the external oblique, we had the internal oblique, we had the rectus abdominis, and then lastly here we have our transversus abdominis, okay? All of these muscles are going to be responsible for compressing the abdomen, increasing intra-abdominal pressure, and they can also help to flex and to laterally move our trunk and laterally move our body from one side to the other. So think about whenever you're doing crunches, you're doing sit-ups or something like that, you're working your abs, you're working your abdominal muscles, and your obliques as well here, okay? All right, thank you.